Muscle mass and strength are important factors to our overall health and can affect how we look and how we feel. Dr. Eric Stanek, Chief Medical Officer of DoctorsNow, is here to share why it is important to build and maintain muscle as we are on our weight loss journey. Why is muscle mass so important?
Well, there's so many things that your muscle mass does in the body, and I think one of the big misconceptions surrounding muscle mass is that it's just for aesthetics, for how people look, and that's part of a function that it serves, but it also does so much more than that. Your ability to function in your day-to-day life, carry grocery bags, go up a flight of stairs, sit up from the toilet, these are things that are really easy to take for granted until you get to the point where you can't do that anymore. And the reason why people are unable to do that in their later years is because they lose muscle. Muscle does decline with time. It's an inevitability of life, but there's absolutely things that people can do to maintain their muscle as they get older. Another function of muscle that a lot of people don't know about is its effect on your hormones and your metabolism. So your skeletal muscle, your shoulders, your chest, your glutes, your legs, it is the largest reservoir for blood sugar in your body. So a lot of people think of the liver when we talk about that, but it's actually your skeletal muscle that deposits the majority of your glucose. And so if you have adequate strength, adequate muscle mass, it helps to maintain your blood sugar and your insulin levels, and that's something that's really important, for example, for people who have type 2 diabetes or prediabetes.
So can health problems show up if we are losing muscle mass or don't have enough of it?
Yeah, most people would tell you that when they go to see their primary doctor, that there's not really any conversation surrounding muscle mass or strength.
Just your weight.
Yeah, it's just weight and blood tests and blood pressure and stuff like that. And all of that stuff is important, but I think there should be a stronger emphasis on talking about muscle mass and strength, because we treat a lot of the things that are downstream from weakness and frailty, but we don't always get at the root cause. And so, metabolic dysfunction, prediabetes, type 2 diabetes, non-alcoholic fatty liver, even PCOS, polycystic ovarian syndrome, which has a new name now, but those things can be positively influenced by regular strength training and having adequate muscle mass. Even women who have PCOS, their menstrual cycle can be better regulated just by them doing consistent strength training. Pain is another way that poor muscle mass shows up. Pain in your neck, pain in your back, even osteoarthritis around the knees and the hips. When people go through rehab for these sorts of things, a big part of the rehab is doing strength training to strengthen areas that were weak, take some of the load off of those joints. Another thing that comes to mind is bone density. So for people who have osteopenia, osteoporosis becomes much more common after women go through menopause. The best way to have strong bones is to have strong muscles. And there's other medications, calcium supplementations, that can help women specifically have stronger bones, but the best way for everybody is to have strong muscles. So there's a lot of medical diagnoses that show up as a result of people not having adequate muscle mass or being frail.
So how can we build or maintain muscle and even know how our muscle mass is?
Well, the simple answer is resistance training and protein intake and doing that consistently over time. If you think from first principles, there's three things that are anabolic: hormones, resistance training, and protein. So if we take anabolic steroids and testosterone replacement and stuff like that off the table, hormone replacement should only be used for true medical indications, then that leaves us with resistance training and protein, and that's something that people should be doing all the time. For people who don't have any regular exercise or strength training in their regimen, I can't emphasize how much there is to be gained just by doing a 15 to 20 minute home body weight workout 2 to 3 times a week. If you go from 0 to just a little bit, the gains that you can get from that are tremendous, not just in your appearance and how you look, but also how you feel and your ability to age well over time. Now, when it comes to protein intake, the current FDA guidance for protein is you should be eating about 0.4 grams of protein per kilogram of body weight per day. I find that number to be too low. A lot of health influencers out there are saying you should be having a gram per pound of body weight. I find that to be very difficult to do, often unrealistic. And so the sweet spot I find is about 0.8 grams to a gram of protein per kilogram of body weight. For a lot of people, that's anywhere from 80 to 120 grams on a regular basis. Animal protein helps to trigger muscle protein synthesis better than plant protein does, but for people who have dietary restrictions, plant protein's a good option too, and there's plenty of high quality whey protein supplements on the market that people can use for that.
Well, and lots of great information. And you tackle this in your medical weight loss program, which you have an announcement today that includes a special offer.
For sure. We're happy to announce that we are going live with our medical weight loss program in Altoona, effective on Monday, July 6th. So the day after 4th of July weekend, we'll be offering medical weight loss services on the east side of the metro, and we're really excited to bring that service out there. Second announcement is we do have a summer special going on as well. So effective today all the way through July 31st, anybody who signs up as a new patient for medical weight loss will get $50 off of their first month on the program.
Well, thank you so much for sharing this announcement
Awesome.
and this great information as we build muscle.
Yeah.
Thanks, Dr. Eric.
Thank you for having me.
You can learn more. Just go online to doctorsnow.com/medical weight loss or call 515-514-1259. You can also send inquiries to the email address on your screen, and of course you'll find them located in West Des Moines and Altoona now starting next month, starting in July for the medical weight loss program.